Good morning and welcome to Connect MKE. I'm your host, Kristen Bry, and our focus this morning is on teeth. Yes, teeth. Most of us may hate going to the dentist, but understand that taking care of our teeth is important. Yet, despite the impact uncared for teeth can have on your health, these magical little bones require separate insurance from your normal health insurance. This includes people who qualify for Badger Care, Wisconsin's healthcare coverage program for low-income Wisconsin residents. Recipients are often surprised to find out that dental insurance is not included and thus may sacrifice receiving any care for themselves or their children because of its expense. Our guests today are on a mission to help those people. Community Smiles Dental improves the lives of the underserved through oral healthcare services, preventative education, and advocating for systemic healthcare change because everyone deserves a healthy smile. Renee Ramirez is the Chief Executive Officer and Emily Lukasek is the Director of Development for Community Smiles Dental, and both join me this morning. Thank you so much for coming here.
Good morning. Thanks for having us.
How are you doing this morning?
Great. Great.
Well, I just did a kind of high-level overview of what Community Smiles Dental does, but I would love to hear from both of you in more layman's terms of what that actually looks like in day-to-day practice.
Sure. I'd be happy to share. So about 14 years ago, a number of school-based nurses were really struggling with where to take children who were coming to the health room with really very painful cavities, which are infections in their mouths. They could find a place to go for their eye care, for medical care, but they really had no resources for the oral health care, which was the dentist, because of the type of insurance. So they brought their concern and dream to, at the time was Waukesha Memorial Hospital, now Pro Healthcare, and said we need to do something about it. So they put together a business plan and hired me to build a dental clinic and raise money to take it off the ground and to serve children who didn't have access to dental care prior to that.
And I think this is something that a lot of people don't actually understand, is that getting access to dental care is expensive, and especially for if you have state insurance or uninsured, sometimes even finding a dentist who will provide care can be really difficult. And so what does that actually look like for some of your patients or some of the people that you're helping, of how to even start to begin to know where to navigate?
I think, that's just it. And that's one of the things we're so proud to be able to champion here, is something that people don't know a lot about, right? Which is the fact that those that are state insured or underinsured consistently do not have access to this. Understandably, private practices don't accept those on state insurance because the Medicaid reimbursement is so low. So unless there's a public dentistry option available to those families, they're going years and even decades without access to care. Our focus is kids. Which is about 85 to 90% of who we serve, because where there are other public dental providers, they're really focused on adults. And we're so grateful they're there, because there's not enough of us to meet the need, that's for sure. But we believe that if we can start a kid off on the right foot from the beginning, we can change this system and we can get ahead of issues before they're bigger than they need to be. Our additional focus is individuals with special health needs who, again, are often state insured and struggling to find access, not only in those who will accept their insurance, but those who are equipped to and trained to treat individuals with special needs. And then we also have a focus on low-income pregnant moms, because we don't want the mom to have any oral health issues during her pregnancy, which can ultimately negatively impact healthy birth outcomes.
That's because the stat is staggering that I saw on your website. It's 1 out of 4 people in the greater Milwaukee area either have no insurance or underinsured when it comes to dental care.
Mm-hmm. That's true.
That's a staggering number.
Mm-hmm.
And for kids, that equates to about 130,000 kids in our area.
Just our area, not even the state.
Just our area.
And this is not an issue unique to Wisconsin. This is something
it's a national
across
crisis.
The
It's a national crisis. We're one of, I think, 15 states that actually offer some form of dental insurance through the Medicaid Badger Care system for adults. A lot of states do not offer that at all, but children are covered.
So this may be a hard question to answer, but why is it separate? Why is our because I said there's so much health that happens in your mouth, and it's more than the cosmetic teeth whitening or orthodontics and getting your teeth
Right.
straight, but it is actual health diseases and systemic issues that can come from not taking care of your teeth. Why is it separate? Why is it not included in our health insurance?
Well, that you're right. The mouth is the gateway to the rest of your body. So why it has evolved that way, I'm not sure, but that is just how it has happened, right? But we're really proud of the fact that we have piloted a medical dental integration program where we take one of our hygienists and we are placing them within a medical setting, working alongside the pediatrician. So after the pediatrician and or nurse practitioner do the wheelchair visits with the children, then we have our hygienist stop in and talk to mom and the children about their access to dental care. And if they are eligible for our services, we link them right up to one of our clinics. So that's really quite innovative, and it's a national trend, and we just are on the forefront of that trend right here in Wisconsin.
Yeah, then that's incredible. And so speaking kind of giving you an opportunity to brag about some of the other achievements or numbers or amount of people that you've helped in the last couple years. I know that I got access because I was at your fundraiser last month, Laugh for a Smile, where you raised a lot of money to be able to continue to provide care. But I was very impressed with the amount of people that you're actually reaching in just our little corner of Wisconsin.
Yeah. Today, Renee talked a little bit about how we started, but today we have 2 clinics, full service clinics in downtown Waukesha and in Menominee Falls. Our Waukesha clinic is about 14 years old and our Falls clinic is 4 years this year. Those clinics right now are allowing us to serve the 4-county region, and because of the second clinic, but also because of the unprecedented demand we've been experiencing due to the pandemic, more income qualifying families, and again, few and far between options for our families to go outside of our clinics, we increased from about 3,000 families to 4,400 unique patients in 2021, and right now we're on pace to serve 6,000 individuals in the 2022 program year. That's a rapid growth rate, but one we're taking to heart because of the continued need and demand for our services.
And if I can further brag, one of the things that I am really proud of is that we have become the dental home for these children, which means that they come back regularly for their 6-month appointments, just like you and I might do, whether or not we have insurance. And the statistic that I like to share, now this is pre-2020, but in 2019, 85% of children were coming back regularly for their appointments, so that's a huge number, and 74% of them were coming back without any cavities. So the education that we were providing at every visit, in the schools, in the waiting room, really did make a difference. So the impact on their overall health and the ability to sit, listen, and pay attention in class, their parents didn't have to take off of work, was huge because they did not have that active infection, the cavity in their mouths. So I'm really proud about that.
And I think that dental home piece, well said, is really important because true healthcare equity is not one-off, right? It's ongoing and it's routine, and it's helping individuals have regular care and get ahead of things that are preventable issues. So that is something we're really proud of in terms of the way that we operate. And once you're with us, we stick with you, and we're there to help you live a healthy and happy life.
So that is, once a patient is a patient, if they start at 6 until they're 18? I mean, because if you've been around for 14 years, do you have people who've been with you for 14 years?
Absolutely, and we actually have some of our special needs patients that started potentially probably, I think she was 8, and so now she's in her 20s because we don't turn them away at 18 for the special needs. And she comes back, actually because of health conditions, she comes back every 3 months. So she's been a regular patient for the last 14 years.
Oh, wow.
So,
now that is a success story.
Right. She thinks I'm Dr. Ramirez, and I'm not, but...
You'll take it. Just take,
right, exactly,
take the title when
exactly,
they give it to you.
But she said, hey, Dr. Ramirez, so, yeah.
Are there any other success stories or, positive impacts that you know and you were willing to share or can share?
Yeah, I'd like to share, we take our smiles for granted, right?
Yes.
And you actually had a great, start to your presentation when you were the MC at our event a couple weeks ago, where somebody was missing a tooth and they were also missing an eyebrow, and what we saw was the missing tooth, not the eyebrow. Well, there was a young one who had been in a car accident and she lost her front teeth. And she was probably 22, 23 years old, and she came in really heartbroken because she couldn't get a job in a front-facing role because she didn't have front teeth. So we were able to work with one of our volunteers. So we have paid staff, but we also have volunteers who knew exactly what to do, and they fitted her with an appliance that was basically a set of teeth that she could take in and out.
Flipper, yeah.
It's a flipper, yes. And so she was thrilled. She was able to smile, and she was able to get a job. So here we had somebody who wasn't employable. Well, she was employable, but what she wanted to do was be in a front, talk to people, and this really provided her with the opportunity. So I'm really proud of that, and I'm also proud of the kids that keep coming back and thinking I'm Dr. Ramirez and having no cavities.
Yeah.
I know that flipper well. My fiance is currently getting implants of his 2 front teeth. So I see him without his flipper.
But we really,
often. But it makes such a big difference of just being able to, because he is fairly confident to be able to walk around without it because he knows eventually he's going to get them. But to know that is, if you don't have that pipeline to care, and that could just be how your smile is for the rest of your life, to have access to something and people who can actually help you, and how much that can literally change your life and your trajectory is incredible.
Exactly. And I think too, I'm a newer mom, so it breaks my heart in our clinics to watch parents struggle with this and to struggle to find something that should be available to their kids. And I think about a young gentleman who came to us when he was about 4, and he had recently been adopted and come out of the foster care system. He had gone through a number of neglect issues in his prior home, but his teeth were so severely worn and decayed that it was down to the nerve. So he was cutting his teeth or his lip when he was eating, and he was having difficulty with his speech progression. And when they found our clinic, we were able to completely turn that around. And that's the type of stories that really touch me in terms of giving all kids the fair start that they should have in life.
Absolutely. And if there's one nugget of information or message that you want the audience to take away about the problem or how to help, or just the main takeaway from this conversation, what would that be?
My first thought was, don't skip going to the dentist. Just like you see your physician, you should be seeing your physician, at least once a year. You should see your dentist at least once a year and not twice, because when you see the hygienist and she's cleaning your teeth, she's looking for possible cavities, which is an infection. And if you had a cut on your finger that was infected, you take care of it. You have to take care of your cavities. So I'd be remiss if I didn't say that. But also to let people know that we are a resource for individuals who might be on Badger Care. They can go to our website. The phone numbers are listed there, communitysmiles.org. I want people to know that we are a resource for them.
And we also need people's support. The reality of our structure is Medicaid reimbursement is capped at what it's capped. So we exist through the generosity of the community. So those interested in supporting our cause through gifts of time, talent, treasure, that's how we make this work possible. You were at our event last week. We do 2 fantastic, granted we're biased, events each year, and those are another great way to get out and learn more about what we do, support these patients, and give them, like I said, a healthy start in life.
Absolutely. Well, thank you so much for coming in today. I since finding your organization, it's something that I think not enough people realize, that this is a huge problem for so many people, like we said, 1 in 4. So thank you for the work that you do, and thank you for coming in today. Renee Ramirez is the Chief Executive Officer, and Emily Lukasek is the Director of Development for Community Smiles Dental. For more information on everything we discussed today, you can visit their website at www.communitysmiles.org. When we return to Connect MKE, we will switch gears and talk about how you, yes you, can become a part owner of a Milwaukee brewery for just $200. Stay tuned.